Imagine sitting in your favorite chair, feeling relaxed and at peace, taking in a slow, steady breath for a count of 8. Can you fill your lungs that long without gasping for air or feeling uncomfortable? This simple act may seem small, but it reveals something incredibly important: the resilience and flexibility of your lungs. For many people over 65, it's easy to assume that shallow breathing is just part of aging. Yet the ability to take a deep, controlled breath can mean so much more than comfort. It's about maintaining a strong internal foundation for energy, mobility, and overall vitality. If you've been catching yourself sighing more often, feeling short of breath with everyday tasks, or worrying that your lungs simply can't keep up anymore, you're not alone. Many seniors face these concerns quietly. Perhaps you've noticed you avoid certain activities because breathing feels difficult, or maybe you've told yourself that shortness of breath during a brisk walk is just what happens at our age. But imagine how different life could feel if you didn't have to worry about breathlessness. Think of the confidence that comes from knowing you can walk up a flight of stairs or stroll through the garden with a strong, steady inhale and exhale. Taking the time to nurture your lung health is a way of caring for your future self. Breathing well isn't only about preventing respiratory illnesses or boosting endurance, though those are certainly important. It's also about supporting your mind, your emotions, and your ability to remain active and independent. Improved lung resilience can enhance sleep quality, help with stress management, and even make daily movements, like bending down to pick something up or standing up from a chair, feel more comfortable. By focusing on breath, you're not just increasing oxygen flow, you're fueling your ability to enjoy life on your own terms. Today, you'll discover 5 important insights that can transform the way you think about your breath and your lungs. First, you'll uncover the surprising connection between posture and breathing capacity. Then you'll learn why common assumptions about just taking it easy can actually restrict the healing power of your breath. Next, you'll see how your everyday environment might be silently shaping your lung health and the small steps you can take to reclaim control. You'll also explore the role of gentle exercises that anyone, even those with mobility challenges, can adapt. Finally, you'll discover how your mindset plays a critical role in making new breathing habits stick so you can see real, lasting improvements in your day-to-day life. I'm here to guide you through these key areas with the insights I've gathered over years of working with older adults on building vitality from the inside out. While I'm not a doctor, I've witnessed the powerful changes that come from simple evidence-based techniques. If at any point you have medical questions, be sure to consult your healthcare professional for personalized advice. Still, I invite you to listen with an open mind and heart. These ideas have helped many seniors find renewed confidence in their breath, and by extension, in their overall mobility and zest for living. Before we dive in, I encourage you to consider one simple question. If your lungs felt stronger and more resilient tomorrow than they do today, what would that allow you to do more joyfully? Keep that in mind as we explore these 5 insights. You might be surprised at how a few adjustments can make a huge difference. And if a particular tip resonates with you, or if you have a friend or family member who could benefit from this information, feel free to share it. Let's walk this journey together. Let's begin by challenging a common assumption about your posture. Many people in their late 60s or 70s notice a bit of a stoop or rounded shoulders, especially after years spent reading, gardening, or even watching TV. You might think that slight forward lean or slouch is harmless, but it can actually compress the rib cage and reduce your lung capacity. A widespread misconception is that once you start hunching, it's too late to straighten up. Yet your body, regardless of age, can adapt and improve with consistent practice. Consider Phyllis, a 72-year-old retired librarian who loved her crossword puzzles. Over time, she noticed she was slumping forward, her shoulders rounding closer to her chest. At first, she dismissed it as part of the aging process. But she also realized she was taking shallower breaths and found herself short of breath even while carrying a small bag of groceries. Phyllis believed that the only solution was to accept the new normal, until she learned about gentle posture work. Through something as simple as placing a small pillow behind her lower back when sitting and reminding herself to roll her shoulders back, she reclaimed her breath. Within a few weeks, she noticed she could inhale more deeply. Her posture improved, and she had more energy when walking around the block. Research suggests that maintaining an open chest area can significantly increase the amount of air you draw in. More air means more oxygen in your bloodstream, translating to better overall energy and alertness. To achieve this, start with a simple daily habit. Whenever you sit or stand, imagine a gentle string pulling you upward from the crown of your head. At the same time, think about engaging your abdominal muscles slightly, just enough to feel supported in your lower back. This isn't about standing as straight as a rod. It's about feeling tall, open, and relaxed in your torso. Give yourself a subtle reminder every hour. Set a timer on your phone or a gentle alarm, and take a few seconds to check your posture and do 3 slow, deep inhales. Breathe in through your nose, letting the air expand your rib cage, and exhale through your mouth. As you exhale, release tension in your neck and shoulders. Physically, this practice can reduce muscle aches and improve how well your lungs function. Emotionally, standing tall often translates to feeling more confident and poised. This small step can make a big difference in how you carry yourself throughout the day. Now, if you're already dealing with mobility issues or you use a walker, you can adapt this approach. Instead of standing, you might sit in a sturdy chair with a cushion behind your lower back, making sure your feet are firmly on the ground. Gently lift your chin, roll your shoulders back, and take that nourishing breath. Over time, this posture-focused breathing can help you feel more stable and less prone to slouching. It's never too late to make adjustments, and your lungs will thank you for the extra space. You may be thinking, I've been stooping for years. There's no way I can reverse that now. But remember Phyllis's story. Change happens gradually, but it happens. The body is adaptable when given consistent cues, and each day you practice improved posture is another day you're creating a healthier environment for your lungs to operate at their best. If you're feeling motivated, go ahead and make a small mental note to check your posture whenever you move from one activity to another. Even standing up to grab a glass of water can become a reminder to align your spine, open your chest, and breathe deeply. Feel free to pause here if you like, stand up, and experiment with that technique right now. Next, let's address the notion of taking it easy as we get older. It's common to hear, don't push yourself. You're not as young as you used to be. While caution is sometimes necessary, especially if you have health conditions, there's a flip side to this thinking that can limit your lung capacity more than you might realize. One misconception is that as soon as you feel winded, you should stop moving altogether. However, mild to moderate physical activity can actually help your lungs stay more flexible and responsive. Think of Harold, an 80-year-old former mechanic who prided himself on being tough and independent. He'd always loved to tinker in his garage and keep his car in top shape. In his late 70s, he began feeling winded after just a few minutes of working on the car. His grandchildren urged him to take a rest. Soon, Harold found himself avoiding the garage and spending more time in front of the TV. His stamina dropped dramatically in just a few months, and he had more frequent episodes of breathlessness. After consulting with a physical therapist, Harold learned that gentle, regular activity, like a slow lap around the block or simple stretches in the morning, could keep his lungs more engaged and slow down the decline in his breathing capacity. Evidence supports the idea that light to moderate exercise increases your lung elasticity by challenging your respiratory system. When you regularly engage in a bit of controlled physical effort, your lungs learn to expand more effectively, and your body adapts to supply the needed oxygen. This doesn't mean training for a marathon. It can be as straightforward as a 10-minute walk in your neighborhood or a gentle seated exercise routine if you have balance concerns. The key is consistency, aiming for daily or near-daily movement that raises your heart rate slightly, causing you to breathe a bit deeper than usual. As you incorporate a little more movement, remember to listen to your body, but also to distinguish between genuine distress and the normal feeling of being slightly out of breath. In the early stages, you might feel mildly winded, and that's your lungs stepping up to the plate. Over time, what used to leave you breathless might become easier. The physical benefit of this is clearer, deeper breathing, and improved endurance. Emotionally, you might find a sense of accomplishment and confidence in staying active rather than retreating to the couch. Small gains, such as being able to climb stairs with less difficulty or run an errand without feeling exhausted, Add up to a more independent lifestyle. Here's a practical exercise to try. Next time you're watching TV, get up during a commercial break and march in place for 30 to 60 seconds while focusing on slow, steady inhales and exhales. Pay attention to how your body feels. Over weeks, you might notice you can do this for longer periods without feeling winded. This is a sign that your lungs and your overall fitness are adapting. It's perfectly fine to hold on to a chair or countertop for support if needed. Remember, the goal is to gently challenge yourself, not to overdo it. If you have any heart or lung conditions, check with your healthcare professional before starting something new. But don't let age alone scare you away from the healthy tension that slightly elevated breathing can bring. Before we move on, take a moment to reflect on where you can add a bit more activity into your day. Could you walk an extra half block when getting the mail? Could you do a few gentle arm circles after breakfast? Perhaps you could dance to your favorite song in the living room, even if it's just swaying side to side. Share this thought with someone in your life and see if you can encourage each other. Let's shift our attention to the environment you live in. A common misunderstanding is believing that lung health only depends on personal habits like exercise or not smoking. Yet the air quality and surroundings in your home can have a huge impact on how easily you breathe. It's not just about pollution or allergens outside. Sometimes your bedroom, living room, or even kitchen can harbor irritants that make breathing more labored than it needs to be. Margaret, a 68-year-old retiree, often felt congested and slightly breathless when waking up in the morning. She never linked it to her home environment. She'd open her windows only occasionally, fearing drafts, and her house was filled with beloved old rugs and drapes. Over the years, dust and other particles built up, which subtly compromised her indoor air quality. Margaret assumed her breathing issues were just part of aging. One day, her daughter insisted on cleaning out the old carpets and installing an air purifier. The difference was remarkable. Margaret realized she could take a deeper, more comfortable breath in the morning, and she even slept better at night without that feeling of congestion. Studies indicate that poor indoor air quality can exacerbate breathing difficulties, especially for older adults who may already have sensitivities or conditions like COPD or mild asthma. Simple steps can help. Regularly vacuuming with a filter-equipped vacuum, washing drapes and linens in hot water to remove dust mites, and considering the removal of old carpeting can reduce allergen load in your home. Also, try airing out your house when weather permits. A brief exchange of fresh air daily can do wonders. If you live in a high-pollution area, time your window opening to hours when traffic is lighter. Some seniors find that an air purifier in key rooms significantly improves their comfort, especially during allergy seasons. Don't underestimate the impact of scented products. Sprays, plug-in air fresheners, or strong cleaning agents can irritate sensitive lungs. If you enjoy scented items, consider milder options like a lightly scented candle used occasionally in a well-ventilated space. Pay attention to how you feel in the presence of strong fragrances. You might notice a slight tightening in your chest or an increase in coughing. This is a clue that your lungs are being irritated. The physical benefit of maintaining cleaner indoor air is straightforward. Your lungs don't have to work as hard to filter out irritants, leaving you with more capacity for oxygen exchange. Emotionally, you might find greater peace of mind, comfort, and perhaps fewer sleepless nights caused by congestion or coughing. Another small but helpful tip: keep your home at a moderate humidity level, if possible. Extremely dry air can irritate your airways, while overly humid conditions can foster mold growth. A humidity monitor is inexpensive and can guide you in using a humidifier or dehumidifier as needed. The result is a more supportive living environment for healthy breathing. Take a short pause and ask yourself, how often do you think about the air inside your home? When was the last time you changed your air filters or aired out a room? Perhaps now is a good time to consider small adjustments like those Margaret made. You might be amazed at how quickly you notice a difference in your day-to-day breathing. Now that we've addressed posture, physical activity, and environmental factors, let's talk about specific practices that focus on strengthening your breath. Many seniors think that the only breathing exercises are those complex yoga-inspired techniques that require twisting into difficult poses. Not so. You can improve your lung capacity with simple routines that adapt to your comfort level. The misconception here is that advanced techniques are necessary for results. In reality, even a few minutes of mindful breathing exercises each day can yield significant benefits. Take George, a 77-year-old retired school principal. He developed a habit of quick, shallow breathing from years of stress and hurrying around the halls. After retirement, he noticed that his shallow breaths persisted, making him feel anxious sometimes. He learned a basic 4-4-6-2 pattern. Inhale for 4 counts, hold for 4, exhale for 6, and hold again for 2. Within a couple of weeks, George reported feeling more relaxed and able to take deeper inhales during everyday activities. He didn't need fancy equipment or a gym class. He simply dedicated a few minutes each morning and evening to practice. Breathing exercises come in many forms, but the principle is similar. You aim to slow down, deepen, and regulate your breath. One popular method is pursed lip breathing, where you inhale through your nose for a couple of counts, then exhale through pursed lips for twice as long. If you can manage an 8-count breath in, fantastic. But you can start with a shorter duration and gradually lengthen it as you get more comfortable. The key is consistency. Doing it once won't make a huge impact, but practicing a few times a day for weeks or months can reshape your breathing habits. Physically, structured breathing exercises help improve lung function, increase oxygen uptake, and can even assist in regulating your heart rate and blood pressure. Emotionally, many people find these techniques calming. They can help reduce feelings of stress or anxiety that sometimes accompany health worries. There's also a sense of accomplishment in noticing that your breath capacity is growing. It's a tangible sign that your lungs are staying resilient. If you're new to this, start small. Pick a time when you're unlikely to be disturbed, perhaps right after waking up or before dinner. Sit comfortably with your back supported, place a hand on your abdomen, and breathe in slowly, feeling your abdomen rise. Then exhale just as slowly, noticing your abdomen fall. Over time, challenge yourself to extend the count by a second or two. You'll likely find that with practice, you can inhale more fully and exhale more completely. Consider adding gentle arm movements to accompany each inhale and exhale. Raise your arms overhead as you breathe in, and slowly bring them back down as you breathe out. This encourages full chest expansion. If raising your arms that high is uncomfortable, go only as far as feels right for your shoulders. The important point is to pair movement with breath, further enhancing lung capacity. It can also serve as a mini stretch session. Check in with yourself now. Have you ever tried systematic breathing exercises? If not, are you willing to devote even 3 minutes a day to see if it helps? Jot down a note or set a reminder on your phone. Sometimes the biggest barrier is simply remembering to do these simple exercises. Try it for a week and notice any subtle changes in how you feel, both physically and emotionally. Finally, let's explore the mindset piece of lung resilience. A frequent misconception is that changing how we breathe is too basic or too difficult, so it's not worth the time, or that it's too late to make a difference after 65 or 75. This mindset can create an invisible barrier between you and better health. In truth, your beliefs about your body's capabilities can either open doors to new possibilities or keep them firmly shut. Olivia, 69, had always struggled with stress-related breathing issues. She'd get anxious about her health and fall into a cycle of shallow breaths. What's the point of trying, she thought. My body is too old to change. But once she started viewing each small step, like practicing a brief relaxation exercise or being mindful of her posture, as part of a journey rather than an all-or-nothing fix, she began to see results. Each week she'd celebrate little victories, feeling less winded after climbing the stairs or noticing that her shoulders felt looser. These small wins fueled her determination, showing her that progress is definitely possible. Shifting your mindset involves recognizing that your lungs can adapt and strengthen at any age, especially with consistent, gentle efforts. Viewing setbacks, like days when you feel more breathless, as temporary can help you stay on track. Instead of saying, "I'm too old for this," try reframing to something like, "My body is learning new ways to breathe and move." This shift supports emotional well-being and combats discouragement. Reminders and positive self-talk can be surprisingly powerful. For instance, you might tell yourself, "I am allowing my lungs to open," as you inhale each morning. While it may sound simple, These affirmations reinforce a sense of capability rather than limitation. Mindset extends to the people around you too. If family members or friends see you making an effort, they might join in or at least offer encouragement. On days when you feel down or frustrated, leaning on a support network can make all the difference. Share your breathing milestones. It's natural to seek a bit of reassurance, and it can be motivating to hear, "I've noticed you're not getting as winded lately. How great is that?" That positive feedback loop helps you maintain momentum. The physical benefits of a supportive mindset are linked to reduced stress hormone levels, which can impact everything from heart health to immune function. When your stress and anxiety decrease, your breathing tends to become more relaxed and efficient. Emotionally, you'll feel an increased sense of empowerment. Each deep, steady breath can serve as a reminder of your potential. If you need a little help with shifting your perspective, you might try journaling, talking to a counselor who specializes in older adult wellness, or simply discussing your goals with a trusted friend. The key is to remember that every day presents new chances to reinforce your lung health through your outlook and actions. By now, you've seen how posture, activity level, environment, practical breathing exercises, and mindset all weave together to support deeper, more resilient breathing. It's not about perfection or pretending aging doesn't exist. It's about acknowledging that you have more power than you might think. Even small improvements in each of these areas can add up to a noticeable difference in your day-to-day life. You might be feeling energized by these possibilities, or maybe you're still unsure if it's realistic for you. Either way, consider this. Your lungs are working hard for you every moment, even as you read these words. Caring for them with a few mindful decisions can mean the difference between feeling limited and feeling capable. And these steps don't require major life changes. They can be woven into your existing routine. A small tweak here, a mindful breath there, and a shift in posture every now and then. While none of us can predict the future, we can influence how we feel each day through the choices we make. Imagine how much simpler it would be to continue your favorite hobbies, like gardening, woodworking, or simply laughing with friends, if you could breathe more freely. Consider how liberating it is to climb a set of stairs without losing your breath, or to wake up feeling refreshed because you finally had a night of good, deep sleep. Now is the time to embrace these changes. Start by picking just one tip that resonated with you the most. Maybe you'll focus on improving your posture each time you stand up. Or perhaps you'll begin a simple breathing exercise in the morning or before bedtime. For those eager to make a bigger leap, you could try cleaning up the air quality in your home or adding a daily walk to your schedule. If you want accountability, share your intention with a friend or family member. Ask them to check in with you or even join you for a brief walk or stretch session. If you're looking for more ways to stay engaged, consider reaching out to a local senior center or community group where they may have gentle exercise or breathing programs. You could also talk to your healthcare provider about local resources or physical therapy options, especially if you have specific medical concerns. The more you surround yourself with supportive people and materials, the easier it is to maintain momentum. Ultimately, you have many ways to take the next step, from a quick posture check to a thorough home environment review to a simple 2-minute breathing routine. Each action is an investment in your independence and well-being. Whichever route you choose, treat your journey as an ongoing practice rather than a one-time event. And whenever doubt creeps in, remember the stories of Phyllis, Harold, Margaret, George, and Olivia. They're proof that with consistent mindful effort, real transformation is possible. Your lungs are remarkably adaptable, and you have the wisdom of life experience to guide you toward thoughtful, caring decisions. If you're ready to feel more energetic and empowered, start implementing what you've learned today. Whether you try one tip or all 5, the key is to start. Your breath is a source of strength, and each time you nurture it, you affirm your capacity for vitality at any age. So here's your call to action. Choose at least one breathing exercise, environmental change, or movement habit and commit to doing it consistently for 1 week. Notice how you feel, and if you see even the smallest improvement, celebrate that progress. If you'd like, share this video or the tips you've learned with someone you care about. And if you feel inspired to learn more, seek out additional resources on senior lung health or talk with a healthcare professional. Taking charge of your breath is a powerful testament to your resilience. You're not just passively accepting aging, you're actively shaping how you move through the world. And that's something to be proud of. Thank you for joining me on this journey towards stronger, deeper breathing. Every inhale and exhale is an opportunity to reconnect with the life force that carries you forward each day. Remember, it's never too late to expand what you thought was possible. Here's to a breath-filled future, full of confidence and vitality.